You're listening to Grown and Growing with Sonia Hamlin. What's up, y'all? Welcome back to the podcast. I'm so glad you're here because I have a really fun episode coming up. It's fun and informative. So here at the Grown and Growing podcast, we like balance with our topics. For example, we recently had an episode on diet and nutrition. It's actually episode 32 with Coach Nitra Shuttleworth, where she talks about sustainable weight loss through diet and nutrition, right? So we talked about that. Today, we're talking about another way to transform your body, a sort of complement to diet and exercise, if you will. Some women and men want or need a little more help of the surgical kind. And as friend of my head, Tabitha Brown says, and that's their business. This is a no judgment zone, as you know. Today, I'm welcoming Chukwuemeka Onyewu, also known as Dr.O, to the podcast. He's a seasoned plastic surgeon who has successfully performed thousands of procedures for patients who are looking to enhance their beauty, correct their defects, or improve function. He is the owner of Jamachi Plastic Surgery and Medispa in Silver Spring, Maryland, and he's one of the nation's leading plastic and reconstructive surgeons. He has all the credentials. He actually graduated from Boston University at the age of 19. I think that makes him some type of genius or something. He also attended Boston University School of Medicine, and he completed his general surgery residency at Howard University Hospital and completed his plastic surgery fellowship, which is super important, at Georgetown University. He actually talks about why that last certification, that fellowship in plastic surgery, is so important. I learned so much in this episode, and I hope you will too. So without further ado, let's get into this topic. Welcome, Dr. Onyewu, to the podcast. I'm going to call you Dr. O. I hope that's okay.
That's perfectly fine. Thank you for having me.
I'm so glad you're here. I've actually been thinking about this conversation that we're about to have for a long time. And I'm going to just go out and admit that I'm one of those people who likes to follow cosmetic surgery pages on IG. Because I'm just like, well, maybe one day, let's just see what's out there. Let's see what the kind of work people are doing nowadays. But
that's how it starts.
So what attracted you to cosmetic surgery? Did you go to med school thinking that this would always be the path, or?
Funny, when I went to medical school, obviously, when you start medical school, you have no idea what being a doctor is about. I mean, you kind of see TV and all that, but like, what's a day-to-day being a doctor?
Uh-oh, frozen. Are you there?
It's weird. Okay, you're back. Can you see me?
Yeah. Yes, I can see you.
When I was in medical school, I actually did not think plastic surgeons deserved to be called real doctors. Really? I was a hardcore. I want to fight disease, stamp out disease. I want to save the world. I want to help people. And to me, sucking fat, fixing noses, and all that, I didn't think that was really being a doctor. And I thought they should be called something else, not doctors. Like, doctors should be treating disease. And so it's a full circle irony that I ended up being a plastic surgeon. And I was very vocal about it. I wasn't in my head. I would talk to my classmates and stuff, right? But when I the first time I was in the operating room, I knew I wanted to be a surgeon. That's the first step. So you get this vibe, this feel. You're like, yes, I'm at home. This is where I want to be. I love the anatomy. I love the solving the problem right away. That all appealed to me. So I knew I was going to do surgery. The question was just what type of surgery. So I started off doing general surgery, actually. Did 5 years of general surgery. I was a trauma surgeon for a year. I guess I was young. I had the energy. I wanted the challenge. And to me, trauma was challenging because it's immediate. It's a gunshot, stab wound, crack the chest, think on your feet, quick, take care of it, solve it, move on. So that's really what I did for the first part of my training and my work. And then one day I was in the operating room. I used to like to hang around the operating room. Obviously, I love being in the operating room. And a plastic surgeon came in and asked if I would help him. And I was like, sure, what are you doing? And he said, I'm building a breast using the latissimus muscle, one of the muscles on the back. And
Mm,
my jaw dropped, exactly, just like what
wow.
you did. I was like, wait a minute, what? You can do that? He said, yeah. If you help me, if you want to help me. I said, are you kidding me? Of course. So I went in. In fact, he said, if you help me, I have another one next week. I'll let you do it. And then I was taken. So I went in, I helped him. Of course, I was the operating room rat. So I was there all the time. I cut his time in half, whizzed through it. And the
Now,
next week,
why were they using the back muscle? Was this from trauma or was it from
oh no,
like,
cancer. They had taken off the breast from cancer.
right?
So
Okay.
she had no breast on one side and we're just making a new breast. So you can make it using fat or muscle from your body, which
Mm-hmm.
gives it a more natural look. Or you could use an implant, which gives
Mm-hmm.
it a sort of an artificial look, right? So he was trying to give her a more natural look and use the latissimus muscle from the back. So that's how I got hooked. And after that, I was like, okay, I need to go back and train and come back and do plastics, and that's how I
Now,
got here.
did you shift it and say, okay, I only want to do, because there's different levels to cosmetic surgery. So we always think about it as, there's something you don't like about your body and you want to change it. But there's also, you can get also cosmetic surgery if you were born with a deformity or if you had a disease, like you just mentioned, cancer, or if you were in an accident, you can require plastic surgery. So were you like, I'm going to do this kind because it's more noble? Or were you like all in, I'll do everything?
I was, well, remember that was my first exposure. At this point, I was like, I'm in. I want to do this. Is more, it's more exciting. It's more
Mm,
challenging. It's not just robotic, do the same thing over and over again. And once I got into plastics, and plastics is wide. It's head to toe,
right.
reconstruct. So you were kind of talking about the difference between reconstructive surgery and cosmetic. Reconstructive means you're putting something back together. So burn, car accident, cancer, something's been removed, distorted, and you're restoring function. That's reconstructive.
Okay.
Cosmetic means there really isn't anything, there's no loss of any function. You just want to make something look better.
Mm-hmm.
Okay, so those are really the two broad branches of plastic surgery. And honestly, I enjoyed both.
Okay.
I enjoyed both. And when I first started, I did mostly reconstructive. Um, no particular reason, because I think it's because it's harder to build up your reputation with cosmetic, being a young plastic surgeon. But
Mm-hmm.
over time, my practice has just kind of shifted over to cosmetic. But I still do both, and I still enjoy both.
Yeah. And you decided to open your practice. You have a practice in the DC area. How long have you been practicing? How long have you had your own practice?
I opened my practice in the year 2000. I hate to admit it. So August will make it 23 years that I've been
Wow. Okay.
downtown Silver Spring. Yep.
That's a long time to be doing cosmetic surgery. That's good. That's a good track. If you're keeping notes, that's good. You've been doing
Okay.
it for a long time. So what do you
Yes.
enjoy most about it? Like you said, you like the challenge of it. Is that why you keep doing it? I mean,
When I'm honest with myself, I think, yeah, the challenge is sort of like the engine, right? Because
mhm,
remember, I wanted to do trauma, I wanted to do something that was challenging, but I think really it's the fact that cosmetic and plastic surgery allows me to um, exercise the science in my head and the art both. A lot of times when I grew up, you're like, oh, you're good at math, you're a science guy, you're good at physics, you're science. You can't be good at arts and science at the same time, or English and math at the same time. And I think part of me was like, this is something that allows you have to know your science
mhm,
cold. You have to know the anatomy head to toe. You have to know that. You have to be able to operate. You have to know how to operate safely. But you also have to have a creative eye. You have to be able to think in 3 dimensions. You have to be able to say, okay, when this tissue swells and shrinks, what is it going to look like? Why is this off?
mhm,
Why is this left side off from the right? Is it the height? Is it the width? Is it the volume? So I think plastic surgery gave me the opportunity to do both,
mhm.
to actually enjoy the science of it and paint on a canvas as well, so to speak.
Amazing. Okay. So now we're gonna get into the meat of it. Um,
Okay.
so when you think about, so what's popular now? So I think I could probably, I mean, what's popular in terms of on social media, what you hear about in the news is BBLs, right? That's all I hear about is BBLs. But what are women my age and older? I'm 45. What are 40-year-old women and 50-year-old women coming in for? Like, you're older now, you have a little bit more money. You're probably a little bit more confident in what you want to do and where you like to see some changes. So what do you find that we are doing? Women are.
Well, it's funny, the popular procedures come in waves and fads. And you know that. 15 years ago, everybody wanted bigger breasts, right? Pamela Anderson and everybody. And that was it. It was a tiny body, the big breast, and actually breast implants were the number one procedure in plastic surgery world up until about, I would say probably about 2 or 3 years ago, where liposuction passed it. So it's always been like number one. But you're right, the BBL has grown in popularity because now, like you said, the role models, the body role models are the Kim Kardashians and the J-Lo and all that. So now it's the small waist, big hips and butt. But interesting enough, it's I would say you're right. That's a younger crowd. I don't get a lot of 50-year-olds trying to get BBL. Some do. Some will. No, they just don't. They are more interested.
Uh-oh, you muted yourself.
It means that all the changes that occur in the body from having children, right? We try to reverse them. So.
Wait, what did you say? You said women, because you muted yourself for a second, so I didn't hear you.
Sure, mommy makeover.
Mommy makeovers. What is that? Okay.
Right. So that's what I was explaining. So all the changes that occur in the female body from having children, period. And a lot of changes. So sometimes you gain some weight with the pregnancy, you don't lose all of it. Sometimes the belly muscles stretch out during pregnancy, they don't collapse all the way back. You breastfeed, so the breasts swell, and then when you stop, they shrink, but the skin has already stretched, so they fall. So all those are changes that are usually associated with childbirth and pregnancy and children. And so I'd say the 45 and older. Now there's some crossover. For instance, like a BBL, typically we make the waist small and the butt big. I mean, that's in a nutshell.
Can I ask how you make the butt big? Like, because in my head, I'm like, where does it come? Is it your own fat? Is it injections? Do people get implants in their butt? What is in there making it bigger?
So a BBL typically is your own fat. And that's why I say, so we take the fat from the torso, right? So from the belly, from the sides, even the back. Essentially, we go 360 all the way around. We take all the fat. So imagine you're starting off here, we go all the way around, everything shrinks in, right? 3 dimensions. So the front, the sides, the back, you take the fat all the way, the waist shrinks in. Okay. Now, if you stopped right there, your butt will look bigger because your waist is actually smaller, even if I did nothing else. Now, I take all that fat that I've removed and I now put it in your butt or your hips or both. And then I just bring the hips out more, or I bring the butt out more. That's a BBL.
So the fat just stays there now, like that. That is where it lives.
It's your fat. So the fat actually does what we call angiogenesis. It develops new blood vessels in the new place you put it, and that's how it survives. So while it's building these new connections, some fat will die. Most of the time, you lose about 20-30% of whatever I put in there, but you'll keep 70% anyway, and that's enough to make a difference, right? Okay. Mind you, we've already made the waist smaller, so there's a difference anyway, and now you pump out the butt with your own fat. We used to use implants. It wasn't part of the BBL. You can get implants, but the complication rate with putting implants in the butt was very high. Imagine you have to walk all the time, you sit on it, right?
Sit on it all day, or I mean, it's not like you don't lay on your chest all day. Like you just, you sit on your butt.
Right. No, you're right. But I mean, once it's healed, once the implants are in and they've healed, technically you can sit on it all day. It's not going to just, they're soft, but they're solid. They're not like bags like the breast. So you can sit on an implant, but once you put it in, it's got to heal. And during that healing period, if you can't stay entirely still, it's not going to heal properly.
Oh, that sounds painful, even after it's healed.
Right.
Sound like it'll be like I'm always sitting on something. Okay. I get this question. Okay, so thank you for describing what a BB. So a mommy makeover is all of that. So you do a boob job, a liposuction, and a BBL if necessary.
Exactly. So the reason I explained it the way I did is it's sort of like a library of procedures, and you pick the ones, or a menu, and you pick the ones that you need in order to restore what you've lost. So for instance, if the only problem with the breast is that they've dropped, I can do a lift and that's it.
Right.
If the problem with the breast is that they've grown so big from pregnancy, then I can do a reduction. Right. If the problem is I've just lost volume, now they're flat, but they haven't dropped, I can do an implant. You get what I'm saying? So
yeah, so many options.
Right.
I love it.
I love it. Right. And then the belly, there are options to the belly. If you just accumulated some fat around the belly, we can do liposuction and you're done. If the muscles are stretched out, we can repair the muscles, called diastasis repair, or I can do a tummy tuck, get rid of the skin. So there are a bunch of different things that we have on the menu, and we sort of pick the combination that works for the individual.
Mm-hmm. So when I was preparing for this, I was talking to a friend and I was like, I'm talking to a cosmetic surgeon. And one of the things she asked was about liposuction. When you do liposuction, I don't know where she heard this, but there was a myth or a rumor that when you get it and you take it out and maybe you don't follow a health regimen or whatever, and you start to gain weight, that the fat doesn't grow back where you took it out. It just grows in weird places. Like if you took it out of your back, like you get it on your thigh. I don't know. Is that true?
Well, it's actually the number one question asked in liposuction. Number one, is my fat going to move somewhere? That's how they ask it. So I'll explain in a way that I think will make it make sense, right? So you can't make new fat cells. Think of fat cells like a balloon or a suitcase. When you gain weight, your body puts fat into these balloons and they expand and you look bigger, right? And when you lose weight, your body takes fat out of those cells and they shrink, right? So that's how you gain weight, lose weight normally. And that's why some people, no matter what they eat, they can't get to 900 pounds. They just don't have enough fat cells. Genetically, they were not born with enough. And some people can gain weight easily, right? Or some people can gain weight in their thighs, but not in their belly. Their lower half is big because genetically they have more suitcases in their thighs than they do in their belly, right?
Okay.
Now, when you do liposuction, we take these balloons out, we take them and we throw them away. They're gone, right? So now if you consume more calories than you burn, and your body's looking for where to store this extra calories as fat, there are no suitcases in your belly. I just took all the fat out of there. It finds wherever you have enough bags and puts it there. And that's genetically determined. Right. So it could be your thighs, it could be your arms, it could be your butt, it could be your breast, it could be anywhere that you have a larger complement of cells to store that extra. You get what I'm saying? And that's so it looks.
You muted yourself again. There you go.
Just can't gain weight where the fat cells have been removed. That's all.
Okay. Wow. Yeah. Okay. Okay. That's interesting.
But you have to gain weight, and you have to gain a significant amount of weight to even see it.
Yeah. You muted yourself again. I don't. Your hand. I think your hands keep touching the screen. There we go.
Okay, I'm back here. So if you have to gain a significant amount of weight. So for instance, if you have the procedure and you gain 5 pounds, your body will distribute that 5 pounds pretty evenly amongst wherever you have your suitcases. You have to get to like 10, 15 to now see some kind of unequal distribution of that new fat. You get what I'm saying? So I always tell people, if you can stay within 5 pounds of your weight at surgery, you're not going to notice any difference. And you definitely cannot gain it back where I took the fat out, because you can't make new fat cells.
Okay.
Right. And
You
don't
cannot
look
make
at,
new fat cells.
no, you can't. Right. And don't look at your stomach as a gauge to whether you're gaining weight, because the fat cells are gone. Your stomach's gonna be flat all the time. Step on the scale or look at other parts, because the stomach is gonna be a bad guide to whether you're gaining weight.
Interesting, because you can get, but so people who get liposuction, like they liposuction their back and their torso and their thighs, like they're not gonna get the fat cells there anymore.
No. But
They
but
gotta be
you get it
careful.
somewhere. You get it somewhere because you can't liposuction your whole body. So, and you may not be happy where you get it. You might get the nape of your neck, or you might get it in your calves, but you'll get it somewhere.
Not cankles. Oh gosh. Okay. So if you so I guess that leads me to another question. So cosmetic surgery, especially when you're getting like something like liposuction or a BBL, is not used to, like, how important can you talk about how important it is to maintain like to be healthy, exercise? Like, what do you tell your patients about that aspect of it? How do you maintain what you have? How do you protect your investment after?
Yeah, I think it really starts from before. I mean, you talk about after, but to be honest with you,
Uh-huh.
if you have very bad habits before, there's no eureka moment. You're not going to wake up the next day and suddenly you're going to be, a prize fighter in the gym. That's not going to happen. So I try to start from the consultation. Like, let's look at what got you here.
Mm-hmm.
Let's understand that this is not it's not a weight loss procedure, because fat cells are very light. They float on water. You don't lose a lot of weight. Even if your shape changes, you don't lose a lot of weight. So it's not a weight reduction process or procedure. One, two, you have to maintain, just like I told you, you have to maintain your weight. So you got to figure out what you're doing wrong, and you need to start correcting. And I give them simple things. You don't need to go on a starvation diet. That's not going to work. But we give them little pointers, how to reduce your carbohydrate load, not eating late at night, cutting out soda, and some certain things that you can do,
Mm-hmm.
simple things, right? So before, and not only that, but you have to understand that these are elective procedures. These are procedures on people who are not sick, right? They're not dying, they're not bleeding, they're not in pain. So you can't um, you can't operate on someone who for an elective procedure if they have other problems that are more important, that are more serious, right? So you can't have your diabetes poorly controlled and then you want to come and get liposuction. That's not going to work. A, it's going to complicate your procedure, but B, it's you need to handle that first. And so
Mm-hmm.
we do a lot of screening. We screen for bleeding disorders, for uncontrolled diabetes, uncontrolled hypertension, heart disease, and a lot of these things are silent. You're functioning
Yeah.
every day. So that's the first step. We need to get you to where, okay, truly you are in optimal health. Now we can go ahead and do this elective procedure. And then I try to give them guides. I mean, yeah, for people who want to go all in, can get a nutritionist, can get a personal trainer, they can work that. But there's some simple things, honestly, if you look at what they're doing, what their daily routine is, there's some simple things you can do that will help,
Mm-hmm.
and, weighing yourself once a week so you know where you are. If you gain 2 pounds, you should know at the time you gain 2, not when you gain 30. You know what I mean?
Right.
And you can look back at the week, you will know why you gained the weight. Oh, yeah,
Mute.
I ate that big pizza pie on Wednesday night. You know what I mean? So
Yeah.
generally you can figure it out. It's really not that difficult. You can figure it out. And I just help give them guide. And most people do well. Most people do well.
Do you ask people to lose weight if they're doing like a liposuction? Are you or if you're getting a tummy tuck, can you just cut out all of the excess fat?
Yeah.
Or
Yeah, you can.
okay, so
You can. So
you don't necessarily have to have a
not for the procedure. So the only two things I do, if your weight is unsafe. So there's a weight generally above 250. It's more on your BMI, but generally above 250, the complication rate goes up for performing elective surgery. So I try to get them below that weight if they're higher than that. And it's a good sign that they're going to take this seriously. So,
Mhm.
but that's more of a safety issue, a safety for surgery issue. The other group of people are those who are actively losing weight. Let's say they are on a good diet, they've been losing weight, I'd like you to plateau. I'd like you to be sort of steady at the time of surgery, because if I do the surgery, I can only sculpt you at the weight you are the day of surgery, right? You have to look good at that size, that weight. So if you go lose another 30 pounds, you can change the shape that I put you in.
Right.
And then we're back to square one. So if you're actively losing weight, I have them wait until they're steady, plateau, before we do the procedure.
Okay. So I'm going to ask specifically about boob jobs because somebody will kill me if I don't. If you are getting a breast reduction, is it necessary to, I know you kind of alluded to this at the beginning of our conversation, but you can get a breast reduction and not necessarily have to get a implant. You can just use your own fat or whatever.
So let's do it this way. It's there are three things you do to the breast, and some combination, but three major things, right? Breast implants means you're taking an implant, you're putting in, your breast size must go up. You're adding something to whatever you have. That's an augmentation, right?
Right.
Implant. Breast reduction, I'm making it smaller. We don't put anything in because you already have a big breast. We're trying to make it smaller, right? That's a breast reduction. Your cup size goes down, right? So implant, augmentation, cup size goes up. Reduction, cup size goes down. A lift, a breast lift, your cup size stays the same. All we do is take a drooping breast and bring it all up, right? So basically the same amount of breast tissue in a smaller skin envelope. We take extra skin out and put it in a tighter envelope, and it comes up and out, and your cup size stays the same. Those are the three ways you can change the breast. Now, there are some combinations, like I could do a lift, and you're like, oh, but I want to be bigger. I can add an implant. So I can do it combined. But you'll never do a reduction and add an implant because you're trying to get smaller. Exactly.
Okay. Right. Yeah, because I'm thinking about people who have really big boobs, but they're like way down here.
We bring them up. We reduce it, bring it up, put it in a smaller envelope, and make them look like they have implants in there, but we use their own tissue. That's correct.
Okay. This is not my question. This is another person who will not be named. Do you, when you're doing a breast reduction, do you get new nipple sizes? Like, do you re-sculpt the nipples?
Yes. So the areola, not the nipple.
No,
so you're talking about the
areola. I'm sorry. I did breastfeed at one point and I knew the difference. I knew the difference, but the areola, yes.
Right. You want the new areola to match the size of the new breast. So if the areola is really wide, we redo it, make them narrow, make the circumference smaller.
I'm like, they're gonna give you a new nipple. Like, why would they keep a big old nipple? I mean, a big old areola, excuse me.
Yeah, we'll change it while we're there.
Yeah, okay. I want to go to the face for a little bit because somebody did ask me about face. This is me out of curiosity. Do Black women get facelifts? Do you see a lot of Black women getting facelifts?
No. I mean, they do get it, but you're right. Our skin tends to maintain its integrity by much, much longer. We tend not to be in the sun a lot. I think a lot of the changes that happen in the Caucasian skin are from sun damage. So you're right. But they do. I mean, we do facelifts in Black women and men actually, but it's definitely not as common as it is with white skin.
Is it usually so? As a facelift, are you just lifting up your chin? Like, is it just your chin area and you're just pulling your face back? I know if people are gonna watch this on YouTube, they're gonna be like, what is she doing?
I know. You put one finger on your cheek and one finger on your chin.
Okay.
And slide it towards your ear.
Okay.
That's what a facelift does.
Oh, all of this.
It moves all that back towards your ear. And you can get the neck too. If there's loose, we can pull that, but everything goes towards your ear. Up towards your ear and tightens the face. That's what it does.
Now, why do people look too tight? Like, why look like, you know how you get stitches and then sometimes the stitches are too, like, why do some people's faces look super pulled?
Because they want to look super pulled.
Okay, that is a personal choice.
Because they want, because they want to. So when people ask for facelift, like, well, how long is it going to last, doc? And you're like, well, 10 years, 20 years. But the theory is that the tighter you pull it, the longer it will last, right? So it'll take it longer to come back all the way down, right? So some people will do that, or some people are getting a second or a third facelift. You know what I mean? So each time, right, you're taking out more skin, and it starts to look very, very tight, like that face in the wind. Yeah.
Do you think that like Botox is like can be a substitute for I know, so I think more Black people are open to, Black women are open, and men too are open to getting Botox. Like I used to think like maybe that was a white woman's thing, but I think Black women are getting it as well. Is that?
Absolutely. Absolutely. I don't think there's any difference between Black and white women in terms of getting Botox and fillers. So, because Botox treats wrinkles.
Mm-hmm.
And you get wrinkles, not just from old age wrinkles, not that, but even the wrinkles between your eyebrows, right? Yeah. Figure 11, right? And the wrinkles across your forehead.
I have a lot of those. Mm-hmm.
But those are wrinkles caused by muscles of facial expression. So when you're surprised, you open your eyes. When you're angry, you squeeze your eyes. Right. When you're surprised, when you're elated, So those are all muscles of facial expression, and they can be blocked. Botox blocks the muscles that cause the wrinkles. That's all it does, and that's why you can only block muscles that you don't really need. Like if you can't look surprised, life will go on. You're going to be okay, right? But if I block
Nicole Kidman is a whole actress. She can't even move her face. Right. She looked the same. Right. She has to talk on how she's feeling. Exactly. I am feeling this now, because you can't see, her face does not move. But how does that feel? Do you just feel numb, or do you feel? Is it like
feel normal? You just can't move the muscles. You feel it doesn't numb your skin at all. You feel normal, and you try to raise your brows, and they just don't go. They just don't go. Right. It's
weird. It wears off eventually. Does it? Like how long does it last?
3 or 4 months. It will last before it wears off. Yeah.
I thought it lasted longer than that. Okay, so 3 or 4 months where but I guess you just get used to not. I feel like, with Botox, I feel like you can be as liberal with that. Do you do Botox or no?
Yeah, of course. Yeah.
Okay. Do you ever, so how do you, when you're evaluating patients for procedures and they come in, how do you know that they're being like realistic with their expectations of what's going to happen?
It's actually taken years to sort of, there's no great answer to that question. It's sometimes it's a feel. Sometimes I try to ask questions to sort of see what triggered this desire, and to get an idea of whether it's, like if your husband is leaving you and you think getting boob job's going to keep him, it's the bigger issue. You need to deal with your relationship. It's nothing I do is necessarily going to translate. So I try to get a feel for why they're doing it first. Mm-hmm. Expectations, I could talk them through that. I can show them before and after pictures of other people. I can find somebody who's got a similar height, weight, shape, and show them like, this is what you can expect. Mm-hmm. And if, or I can ask them, I'll ask them, what do you expect? You want to look flat? Do you want to look like you're, 10 years old, 16, 25? I'm trying to get a gauge for what they're thinking. And I can always correct it if it's unrealistic. Mm-hmm. But ultimately, if they're adamant and it's unrealistic, then I just won't operate, because it's a recipe for disaster.
Right. And I'm sure you've turned people down. Have you turned people down?
I have, or I've tried to talk them into something else, mm-hmm. That's more appropriate for what they're trying to do. But I've also turned people down. It's just we can't do it.
So I saw on your page that you had, when I was on your website, I saw that you were on the news talking about injections, and how people were getting illegal injections in their butt. Now, hopefully when they my age, they're not doing that. Like, you've seen enough stories, but I am curious as to why people think they can inject things into, what are they injecting into their butt, and why do they feel like they can do that? Like,
all right, so think about it this way. Mm-hmm. You can, all right, you want your butt to be bigger for whatever reason, right? And somebody tells you, well, you can go see a plastic surgeon, you can spend $10,000 and get an implant. We used to do implants before. Or you can go have surgery, spend $10,000, get the BBL, right? Or somebody says, hey, I know somebody who got these silicone injections. They're $300 a session. And, they had 2 sessions, 3 sessions, and their butt was, blew up. You know what I mean? So, it's like it's choices in life. A lot of people make a lot of bad choices. So, right. But these are not done obviously by physicians because it's an illegal, it's not even FDA approved. And what made it worse is the fact true medical grade silicone is inert. It doesn't cause any problem. You can inject it in, your body's going to react to it. Inflammatory reaction, that's what makes the butt swell up. But other than that, it's not the actual.
Not even the actual silicone that makes it bigger.
It's the reaction,
your body reacting to it.
Reaction to it, because they don't inject, the volume they inject is so small. But what happened is because it's not monitored, then people were doing these in hotel rooms and basements, and then they started using other substances because medical grade silicone is hard to get. People were importing it from South America. They don't sell it in America. So people started using motor oils. People started using silicone from Lowe's and Home Depot and all these other, and that's when problems started. People started having kidney failure and dead skin and infections and dying, right? And that's when the whole thing, came up. So silicone injections under the skin been around for a long time. I think in the transgender community, they were using it 30 years ago for small amounts in the cheeks and trying to change facial, look. Still done under the table, but and somebody's, we're doing the cheek, let's do it in the butt, and let's put more, and and that's how it just took off.
So what happens when you inject it into your body? Does it stay there? Does your body find a way to release it? Like, how long does it stay there?
Forever. Your body builds a little wall around it, right? To protect. Your body recognizes it as foreign. And this is foreign. And then builds a wall around it to shield your body from this foreign substance. Same way we do it with a bullet, what's lodged under your skin, or any kind of foreign body, right? So that wall is called a capsule. Even the body does it with breast implants, builds a little capsule around it, recognizes it as a foreign body, builds that little capsule around, and then it just sits there. It just sits there and doesn't, right?
So when people, so I'm thinking about like a Black China, Angela White, K. Michelle they're getting their injections removed, or I'm getting my injection. So you just go in there and remove that capsule? Is that what happens when you?
Yeah, and it sounds a lot simpler than it is because there are multiple injections that are done all over the place. These little bubbles are scattered with your normal fat and your normal tissue, and they're not just sitting there like, hi, come take me out. They're all mixed in. So when you're taking these things out, it's very, very difficult to take out just these bubbles. You have to take out normal tissue with it. And a lot of times it leaves great big deformities. And if it was a substance that's not silicone that has now caused an inflammatory reaction or caused the skin to turn dark or black, or then it's like it's almost impossible to get that stuff out.
Wow. And this is unrelated to that, but so like you said, BBLs are all the rage now. And before it was boobs, but I assume at some point the BBLs will, evolve out of fashion as well. How do you reverse a BBL? Can you just do lipo since it's fat? Do you do lipo to?
You can.
You cannot.
You can. You can just take the fat back out, right? Okay. But you see, remember that when you do the BBL, you pump all the fat and you stretch the skin out. So now you're gonna take the fat out. Will the skin really contract?
Oh my God.
Or will the skin be kind of saggy and loose, right? So, and obviously BBLs are so popular now. I don't think we know the answer yet because we haven't got to the point where we're taking these out in droves.
I was just about to ask you, all these BBLs, what do they look like at 60? Like, I'm just like, what are we?
Yeah, we're gonna find out pretty soon. But even when you talk to them, like some people, I try to talk out of doing a massive BBL. Like, let's get your shape nice, but you don't really need to have this sort of cartoon character looking thing. And they're just like, no, that's what I want. And I'm like, well, what's going to happen when you're 80?
How
And
do
they're
you
like,
find
well,
genes? That's what I would like to know. I mean, look, the
stretch,
Lord
stretch.
blessed me with, I don't need a BBL, but I'm like, finding genes was always hard for me. And they just voluntarily, I
Yeah,
guess, Fashion Nova, they be like,
yeah, yeah. Leggings and stretch clothing, they'll find a way.
okay. One more question. I think I'm going through my little list here, but I do want to ask about, like, if somebody is considering surgery, right, cosmetic surgery, what are some tips that people need to choose the right doctor? Like, how do you've been doing this for 23 years. What would you advise people on how to choose a doctor, a surgeon?
Sure. I mean, I think the first thing is, do a little research. Research is so much easier now than it was 20 years ago, obviously with the internet and all this stuff. So, you know, look it up. Look for, what where the person trained, you
Mhm.
know. You should be able to see their bio, you should be able to see their CV. It's all somewhere. And if you can't, that's a red flag too. If there's nowhere where this person says where they trained, then chances are, they didn't,
And they
So
should have done a residency or fellowship in plastics. Like,
absolutely,
okay,
because there are a lot of dentists, a lot of gynecologists, there are a lot of family medicine people that just put up a sign like, "Hey, I do liposuction," and they'll advertise as a cosmetic surgeon. They won't use the word plastic surgeon because that's copyrighted. You'd have to be trained, but they
right.
use all kinds of other language. But just look at the training of the person. Um, Look for reviews. Like, what are people saying about this person? People who've had surgery done. Um, those are probably the two big things. And then and ask them when you go for your consult. Ask them. We have to answer your questions. If you say, hey, where have you trained? How many of these have you done? How long have you been doing this? What's your specialty? You can
Mhm.
ask them that, and we'll answer the questions. Um, Fortunately, I think a lot of people, or unfortunately, will go with somebody they know wherever that person went.
Mhm.
So if somebody went to Dominican Republic or Miami and came back and did okay, then people are like, oh, I want to go there. What they don't see when they don't do the research is how many complications has that person had. Your friend could have made it out, could be the one that did make it out, or the 20, but there are 10 others who didn't, and that's important information to know.
How
What
do
do you
you
do
find
about
out that? How do you find out what their outcomes are of their patients? Is that somewhere?
there's a national practitioners data bank that collects information um, about every doctor in America, every MD in America. So you can look in the NPDB and National Practitioner Data, NPDB, and that's for serious, lawsuits and serious
Mhm.
complications, deaths. But you can search them. There'll be comments. There'll be disgruntled people. You can
Right.
search any doctor, and you'll see. Yeah, I mean, this is the social media age. It's all that stuff is out there.
Hmm.
And you can look specifically complications of Dr. O, and it will pop up.
Okay. So I
Yeah.
have a question about, so one thing, I work in a hospital, and one of the things we used to tell people, particularly when they were looking for, like, I used to work with heart surgery, that you wanted the person to have done this surgery a lot. And
Right.
you do want that, but sometimes I feel like it's unfair because how you get your start. But also, if I was having heart surgery, I wanted the person who could do it a lot. Do you feel like it's the same for cosmetic surgery? And what?
100%. Because, and you're right, it sounds like it's unfair, but believe me, over time, any physician will get the experience. You're going to get some people. You're going to help. Let's say you may have a mentor that you work with, and you do 100 cases with him or her, so you'll get the experience. But and the way I explain it is this: um, I can teach my son to liposuction. I have assistants who are not even medical doctors who I've taught how to liposuction. And so you're not picking me because of the easy, straightforward case. You're picking me because if there is an abnormal anatomy. If there is something weird that happens during surgery, if there's something abnormal or different, you want the person that has seen it before to be the one there, and not somebody's like, oh my goodness, what is this? Never seen this before. You know what I'm saying? So you're paying me for that expertise, not for the routine stuff, right? Anybody can do the routine, but how do you know whether you're going to be a routine patient or not? Yeah. So I'm 100%. If I'm going to go and get surgery, or my relative or my child, I want the doctor who does just that particular procedure over and over and over again, because they've seen it all. They've seen the weird things, they've seen the abnormalities, and they're not going to be surprised if that happens. That's why you do it.
Yeah. Yeah. And to me, and there's also that, longevity. You can kind of look for integrity. You can kind of look for it, like you said, that experience that is so important. You don't want them to, like, your case to be the first case. This is the first case I've ever seen like this. Like,
absolutely.
So I want to ask one question because I forgot, but it's about technology. It's about, are there, so I hear things like for a while I was like, oh, what is cool sculpting? I should do cool sculpting, but I don't really know what it is. And is there, I was trying to find pictures of it, but you go to this cool sculpting website, it is oddly not, they don't have a lot of pictures before and afters.
Is that a red flag or not?
That's a red flag to me. Oh, okay. That's why I don't think about it anymore. But are there particularly, like, I think, when it comes to like breast augmentations, I feel like that's kind of tried and true. Like maybe there are little differences you can get in technique, right, that the doctor will have. But I'm just talking about, like, I wanted liposuction, and now you doing it. You used to do it with that little suction thing, and now you do it with a laser. I just made that up. But are there things like that?
Well, that's a pretty good made up, because that's pretty close to it. So there's always technology coming out, always. I mean, there are creative minds out there. They're always looking for how to make things better, quicker, cheaper, more effective, less tedious, lower complication rate. I mean, pick it. There are always things to help. Mm-hmm. So Cool Sculpt was introduced as an alternative to liposuction because it was non-invasive. They put this machine on the outside of your skin. It freezes your skin and penetrates your skin to the fat, freezes the fat dies, your body absorbs it, you pee it out, right? That was the whole theory. And you don't have to cut, you don't have to make a hole, you don't have to be in the hospital. Now, when Cool Sculpt was being invented, liposuction was a much more invasive procedure. We used to put people to sleep all the time. We take them to hospital.
You don't put people to sleep now to do liposuction?
No, you don't have to. Exactly. That's my point. So, right. So at the time, it made sense. Like, okay. And Cool Sculpt is not that cheap either. It's like $2,500 per area or whatever. So it really wasn't the price. It was the fact that it was non-invasive, go home same day, recovery is easy,
right?
And you don't have to go to sleep, right? Then liposuction. So while that's evolving, liposuction is evolving. So at first we used to use these. If you go to old YouTube videos, it was like big cannula, right?
Very violent looking.
Yeah. Then they brought ultrasound, which use waves to break up the fat. Then we had PAL, which uses vibration. So they're new techniques. And then laser came. You laughed when you said laser, but yeah, there's a laser.
Oh, it's real.
Yeah, Smart Lipo was a laser machine. Smart Lipo is a laser machine, right? And that laser was supposed to help melt the fat, so it's easier to get it out without the trauma. And all these advances allowed us to move from putting people to sleep, keeping them overnight, to sedation, to literally now I probably do 300 cases a year awake. Like, I don't even put them to sleep at all, right? We numb them, give them a little PO sedation. We do it, liposuction, boom. They go home, they walk out, they go home, they're up walking around the next day. So once we got to that point with liposuction, it just negated, like, why would you do Cool Sculpt?
Right.
And get 20% fat loss, 30% fat loss, when you can just do liposuction, get 100% fat loss, and both are done.
And you have to do multiple. I was like, dang, you got to go back and do multiple Cool Sculpting sessions.
And even then, the results are inferior.
So how do you do liposuction? Do you use the laser technique, or do you do like traditional?
I do. I have 3 different toys that I use. So laser is one of them. I do liposuction with laser. It does reduce To me, it reduces the bruising and the trauma to the body because it melts the fat, you get the fat easier, and it helps the skin to shrink better because the laser we treat the skin. So I like the laser. I also have what's called a PAL. It's a machine that also breaks up the fat with using vibrations and oscillation. So it's less trauma we get the fat out easier, less swelling, less bruising. That's my toy number 2. And my latest toy is called InMode. So it's a radio frequency machine. And the radio frequency is great at getting the skin to contract. It stimulates the skin to make collagen, which helps the skin to contract. So those areas that before we take out the fat and the skin's kind of wobbly and loose and skin never shrinks all the way, now we have a machine that treats that skin and gets that skin to tighten up and get better results. Yeah.
My language. No, I'm just kidding. I'm like, what?
Yeah.
Interesting.
So
no.
we have that. Yeah. J-plasma is the way we do it, and the radio frequency, both.
Okay. That's really cool. Cause I've only seen liposuction with the little stick. With the little tube and
cannula,
jabbing in and out.
Right.
So, okay. So that sounds amazing. What about scarring? So obviously Black women, you have to worry about scarring and keloiding, particularly with, with anything really, because you get a tummy tuck and do you still need to get that big scar? Yeah, because you're like taking out like a section of the stomach.
Yep. Taking out the skin.
Have there been any new technology to reduce to reduce the appearance of a scar?
There are a lot of things we've been using, even over the last 20 years, to reduce scarring. No question. There are gels and creams, there's silicone tape, there's bio oil, a bunch of things we use.
Does cocoa butter work? No.
Not really. With the vitamin E, cocoa butter is just good for it's good for the skin in general, not necessarily for scar. The vitamin E, the cocoa butter with vitamin E is good for the scar because the vitamin E is an anti-scar agent. Okay, so vitamin E is the answer to that question. But keloids are different. Keloids are sort of genetically determined, right? So when you're making a scar, anytime you cut and you sew it together, your body puts like cement to get it to stick together, right? And then once it has stuck and healed, your body chews back the cement, right? And that's in your scar. That's why you see scars are red and raised in the beginning and then they smooth out over time.
Right.
That's the way a normal wound healing should go. Now, patients with keloids have lost the ability to stop scarring. Like there's no signal that says, okay, it's healed, stop. They just continue making scar, right? They've lost that signal. So it's a different animal from just a regular scar. So regular scars respond well to silicone and all these other vitamin E and all that, but keloids don't. They just don't because that signal is lost. So we have to do something extra. And there are steroid injections and radiation and things we do for keloid, for people that have keloid, that help.
Do Black people keloid more, right? No.
Yeah, almost exclusively. Yeah.
Why?
Like it's your genes. Like if you're, it's transmission of just genetically transmitted. I don't think there's anything to do with the melanin in your skin.
Okay.
I think it's just that. And maybe it does, but I think it's a genetic. So you pass it down to your children, pass it down to the children. It just hasn't quite made it into the Caucasian gene pool.
So if you have skin that keloids, like I just happen to have I don't know if that's a keloid, but it does it's a raised scar that I have. But if you have that, you can still, if you have keloid skin or skin that's prone to keloids, you can still have surgery. You just have to take extra precautions and do a little bit extra.
You can have surgery, right? And what I would do is I would start treating the scar before it forms a keloid.
Okay.
So if I know you have a keloid, like you showed me, like every time you've been cut, you've keloided, then if we do a tummy tuck, we'll start treating that scar before it gets raised.
Okay.
Yeah.
So when you do a breast, when you were talking about a breast reduction, when you put the breast in a new pocket, like, and you have to cut, like, I feel like you got to make a whole new boob.
You have an upside down T. So you have a scar that runs from the areola, the bottom of the areola down to the groove under your breast. And then in the groove, there's another line. So it's an upside down T. And so there is a scar with the reduction and with the lift, there will be a scar. The only one that we can get away with almost a tiny scar is in putting the implants, because you only need like a 1-inch incision to put an implant in.
That sounds painful. Do you fill up the implants after? You fill up the implants after.
You can.
You put the implant in? Okay.
You can. There are two types of implants. There's saline implants, put them in empty. You can fill it in once they're in.
Okay.
And there are silicone implants, which are pre-filled, and you just have to put the whole implant in.
Okay.
Filled. But they're squishy, so you can still put it into a 2-inch hole.
With the saline, I always feel like, can you hear it? Like, because water is it's very loose. Is it not loose water? Like, it's not like a water balloon where you're just like.
No, it's only loose if there's air. The only time you hear sound is when there's air and water together. But if you fill a balloon with water completely and there's no air, that you can shake it, there'll be no sound.
Yeah. And the silicone, I understand, is softer, feels more real. The saline?
Slightly.
Okay.
Slightly. But remember, you're putting these implants behind your own tissue. So unless you're an A cup, unless you're flat, you don't really feel the implant. You don't. The implant pushes your tissue forward. So what you're feeling on the outside is your tissue. The implant's just giving you volume behind. Think about it.
Why do some people look so circular, round? Like they just look like little balls.
It depends on who put it in, and depends on if you're flat. If you're A cup,
right,
then you just have skin covering the implant. You'll see the shape of the implant. Again, if you put the implant behind your muscle, then you're going to see your breast and your muscle first, and it's going to look more natural. So when you see those stuck on round ones, it's usually because the physician just stuck them on.
That's how
pretty much.
Okay, I'm gonna let you go because I could literally talk about this forever. Like I'm so curious about it. But how can people find you? How can people find your practice? Find you on social media or online? I will put this stuff in the show notes, but I like for you to say it as well.
Absolutely. Our practice is called Jamachi, Jamachi. So Jamachi Plastic Surgery, Jamachi.com. You can reach us there. My handle on Instagram is The Real Dr.O. That should be easy to remember.
Okay. Yeah. I didn't find The Real Dr.O. Okay, I have to look for it.
Yeah, The Real Dr.O, DR.O, right? The Real Dr.O on IG. But everything else should be under the Jamachi handle, Facebook, and the rest of them. So if you have questions, you're curious, you can always reach me on IG. That's the one I do check. And or come to the office to get a consultation, and we'll chat.
All right. We may see each other again. I may have you here. You may see me. No. Thank you so much. I really enjoyed this conversation. It was fun for me. So thank you so much.
Thank you for having me. It's always a pleasure to talk plastic surgery stuff.
Yeah. And for everybody else, I will see you next time.